Alright guys, welcome to episode 136 on ADHD Superpower. Today is on the comparison of ADHD and autism spectrum genes. While both ADHD and autism spectrum disorder have a strong genetic component and show significant heritability, they are distinct conditions with some overlapping and some unique genetic factors. Both disorders are influenced by multiple genes, and there is evidence of shared genetic risk factors, but also genes that may be specific to each conditions. The shared genetic factors, including the high heritability among families, genetic correlation between ADHD and ASD's genes. Okay, it could be genes and it could be traits or symptoms. So there really more research needed for that. Shared variants and common pathways. Now, distinct genetic factors such as specific gene variants. While there are overlap, research indicates some gene variants are more strongly associated with ADHD, while others are more strongly associated with ASD. Different biological mechanisms also suggest ADHD and ASD may have distinct biological mechanism, especially in relation to neurotransmitter system and dopamine and serotonin transmissions. So there we go. Dopamine and serotonin are linked to genes involving dopamine transmission through specific genes, and how they're affected may differ. And that's for ADHD is lack of dopamine, and for ASD, I believe it's both dopamine and serotonin. There could be serotonin lack in ADHD as well, but the main cause is the lack or the less the depletion of dopamine faster than others. Example of gene specific to each condition. For ADHD, gene related to dopamine and neuroephedrine pathways are more strongly implicated with ADHD. For ASD, genes related to synaptic function and neuronal structure are more strongly with ADHD. In summary, the genetic landscape of ADHD and ASD is complex, with both shared and distinct genetic factors contributing to the development of these conditions. Further research are definitely needed to fully understand and how they interact with environment factors to influence the presentation of ADHD and ASD. Now, I talk about autism in these few episodes coming up because there are research that shows there are genes that are common to ADHD and autistic people. And it's not a disorder because you develop perfect pitch later on, which I'll talk about it in later episodes. However, the symptoms might be the same, but the genes and the neurological development, as well as other environmental factors, are also most important contribution to ADHD and ASD, and proper diagnosis are definitely needed with a licensed psychotherapist or psychiatrist. Always ask your doctor, always talk to your doctor about everything. Take care.